The chief executive and government officials will say a few words before taking questions. Because of the epidemic, please observe social distancing measures. I'll give the floor to Mrs. Karen Lam, the chief executive. Friends from the media, fellow citizens, good afternoon. In the COVID pandemic situation, which has caused us to be worried about the epidemic situation in Hong Kong. And therefore, this morning I convened an urgent internal meeting. And in first instance, I'm going to announce to the public our measures to tackle the new situation, because it involves Omicron, this highly transmissible variant, which is also rampant in the U.S. and European countries. And the Department of Health will give an analysis of the changes involving the Omicron variant. Anyway, in the past 24 hours, we have seen a few community cases, and we are worried that there might be silent transmission chains present in the community. As regards the number of infection chains, we are not too sure now, but then for one cluster involves a young man who lives in Tuen Mun and works in North Point. He has no travel history, and according to information from him, he has never been in contact with any confirmed cases, and he is not a close contact of confirmed cases, and so the mode of transmission is not sure. But as far as gene sequencing is concerned, now we have imported cases due to violation of rules on the part of air crew members, and I believe that is not really a source or case with unknown source. Well, probably is epidemiologically linked to an imported Omicron case, but then the way of transmission is not clear. And of course, there is another dancing cluster leading to confirmed cases, and they have close contacts. And some of the close contacts went on a cruise to nowhere. And then yesterday, we arranged for the cruise to return to Hong Kong earlier than planned, and over 3,000 odd passengers are now subject to mandatory quarantine. So, as I said, I'm going to give the floor to Dr. Lam for a clear analysis. But for the number of confirmed and preliminary confirmed, give you details. Now, if you have kept track of what's happening overseas, you understand that the Omicron variant is highly transmissible, and the transmission is very rapid. It is said that one person can, with a very short period of time, infect 10 persons. So the number of transmission in the community can grow geometrically. Well, although, as I said, we have a known source as from an imported Omicron case, then the way of transmission is not yet certain, and the speed of transmission is different from previous mutant strains. So this is a very alarming signal. According to an investigation, now, for some confirmed cases, they had a lot of activities before they were aware of there being confirmed cases. So for compulsory testing notices, CTNs, they cover over 60 locations, places people have been to, and public transport people have been on. So, although we have yet to see a new wave or the fifth wave of outbreak, I think we're at the verge of another outbreak. So maybe within a few hours, we will have this new situation. So since last night, and I have been in contact with Dr. Sophia Chen, and this morning we convened an internal meeting. I had a briefing personally from the Center for Health Protection, and I've just explained to you our assessment. My view is that given the very dire situation of the pandemic, we have to grasp this very critical moment. We have to contain the pandemic to ensure that there will not be a major outbreak in the community again. Now, I think we are raising with Omicron this highly transmissible variant. So if we win, then we'll be able to contain the spread of Omicron in society. So the measures I'm going to announce can maybe the most decisive and rapid and targeted and comprehensive for the past 2 years, so that we can cut the transmission chains as soon as possible. So we should stop imported cases and also stop the spread of the virus in society. So I will explain these measures to you.
In terms of prevention of importation of cases, given the rampant transmission of Omicron globally, if we continue to have inbound flights, then each day we will have a high number of imported cases each day. These are identified during the test and hold at the airport. Many of the patients are infected with Omicron viruses. They have to be treated at hospitals and isolated. This is causing a lot of strain for our hospitals. Dr. Tony Ko from the Hospital Authority will update us on our capacity to treat and isolate these patients in a moment. Yesterday, the surge of imported cases was already serious. In the past 4 weeks, the case doubled each week. 4 weeks ago, we only had 20 cases. And this week, as at the 3rd of January, we had 123 cases. Yesterday, the 4th of January, we had 36 imported cases in a single day. Even if the number does not surge in the coming days, the tally this week will be the double of the number last week. The increase is drastic, and it is causing a strain on our public hospitals. Our previous measures have been effective. For example, the circuit breaker mechanism. Since we have tightened the circuit breaker condition, now we have only 22 inbound routes. Still, we have to be decisive in preventing importation of cases to prevent the hospital authority from being overwhelmed. 2 years ago, as I said, the priority is to protect our healthcare system. If it is overwhelmed, then it would be very bad. We have considered the places of origins where Hong Kong residents are coming back before deciding the measures today. Starting the 12 a.m., starting from 0 hours on the 8th of January until 0 hours of 21st of January, we will invoke the circuit breaker mechanism for flights from 8 origins. In other words, civic passenger flights will be suspended from these 8 countries. Those who have been to these 8 countries will not be allowed to board flights bounding for Hong Kong, which means that interchange flights will be suspended as well. For those who depart from a place other than the 8 countries but have been to these 8 countries before, they will not be allowed to board flights as well. These 8 places are Australia, Canada, France, India, Pakistan, the Philippines, the UK, and the US. If you have paid attention, you will notice that most of our imported cases are from these places. We hope that this measure can drastically cut down the imported cases to Hong Kong. We understand that this measure would cause inconvenience to Hong Kong residents who have already booked a flight or those who need to come to Hong Kong for business purpose. Itinerary and plans would be disrupted. We understand that. However, the situation in Hong Kong is deteriorating. Without this measure, the public health would be in jeopardy and our previous efforts would be in vain. That's why we have to take decisive actions. So I hope the public can understand that. In terms of preventing local outbreak, we will tighten social distancing measures as well. And we will do so in a proper way. We have to reduce the number of people on the streets and prevent unnecessary gathering and non-essential visiting. As I said, we have untraceable cases. And also, we are not sure about the way of transmission for some cases. We are not clear whether the patients got infected from social gathering, meals gathering, or whatsoever. That's why we have to reduce the activities and require members of the public to follow our directions, including compulsory testing or restriction and testing declarations. Specifically, these measures include the following. We have to be prompt, but now it is already 4 p.m. If these measures come into effect tonight, then it would cause a lot of inconvenience. That's why we are giving it 1 more day. The following measures will take effect starting 0 hours on Friday, that is the 7th of January, for 4 days, for 14 days until the midnight of the 20th of January. It would supersede the announcements yesterday that the social distancing measures would be maintained until the 6th of January. The new set of social distancing measures will take effect until the 20th of January. These include the following. First, all major events will be cancelled and unnecessary gatherings have to be called off. Let me give you some examples. Some major events will be cancelled. These include the events on Friday, that is a local farm fest, as well as the Hong Kong Cycling Fest, which we have been preparing for a long time. I know that a lot of cycling enthusiasts are looking forward to this cycling fest, but it has to be cancelled. And of course, it also includes the meetings scheduled for the new Legislative Council, including the tea gathering tomorrow, which I will host, as well as the meal gathering of the newly elected Legislative Council members. These will have to be cancelled. The policy bureaus will update stakeholders in due course. Second, catering business. This is a very hard decision. However, we have to be decisive, tough, and quick to prevent the spread of Omicron in Hong Kong. We have to adopt the following measures. That is, after 6 p.m., all dining services will be banned. In other words, between 6 p.m. to 4:59 a.m. the following day, there can be no dine-in service. For dine-in service outside dinner hours, these will be tightened as well. For those operating under Model B, C, or D, the maximum headcount for each table will be 2 for B, 4 people for Category C restaurants, and 6 people for Category D restaurants. The capacity will remain unchanged. We want customers to be seated far apart for safety. Performance, dancing, as well as karaoke and mahjong, tinkao activities will have to be suspended as well. And also bars and wine houses will be suspended as well. 59 other premises which are scheduled premises, or 15 premises under 500F will have to be closed, including game arcades, beauty parlors, gyms, theme parks, including performing venues, museums, and so on, entertainment venues, party rooms, beauty parlors, nightclubs, karaoke, mahjong, tinkao establishments, massage parlors, sports centers, swimming pools, and cruises will be closed, as well as activity rooms. For those not regulated by 599F, but are venues under the purview of LCSD, they will be closed as well. The LCSD will release a press release about that in due course. The other, for guest house and convention centers, if it is a bar or wine club inside a private club, or if they are one of the 15 scheduled premises, they will have to be closed as well. But we will not ask the entire hotel or private club to suspend operation. For catering premises inside these venues, they will be subject to the regulations I mentioned as well. Another measure is suspending local tours and all cruises and all cruise to nowhere. A cruiser company has announced that a cruise to nowhere scheduled for departure tomorrow will be cancelled. For high-risk places like residential care homes and so on, we will have to suspend visiting. With visitors, more risk will be brought to the patients and elderly people. So besides discretionary visits, all visits will be suspended. Social gathering ban will be of 4 people, and masking requirements will be in place. All the measures will start from 0 hours on Friday, 7th of January for 14 days. The development of Omicron is very fluid. It comes quickly, and hopefully it will go away quickly as well. So in 7 days' time, that is 7 days from 7th of January, we will review the relevant measures to see whether further tightening is required or if we can relax it. And also, in 7 days' time, we will be able to update you on whether events can occur after 14 days. The priority is to contain the outbreak. From experience overseas, we can see that once there is an outbreak of Omicron, there is no containing it. And this is also a huge pressure for Hong Kong because we are adopting the most stringent isolation and treatment plans, as well as quarantine arrangements.
With the full cooperation of the community, and if these measures prove to be effective, we hope that before the Chinese New Year, we'll be able to contain the situation so that members of the public can spend a happy Chinese New Year. Of course, I'd like to appeal to everyone in Hong Kong, be vigilant, take care of personal hygiene, and refrain from unnecessary outings, stay at home as far as possible, but then you have to be tested as instructed by the government. And for those who have yet to be vaccinated, do so as soon as possible, whether we talk about the first jab or the booster. We should keep an eye on the capacity of our community testing centers as well as community vaccination centers to serve the public. I will now give the floor to Dr. Raymond Lam, Director of Health, to brief us on the state of transmission leading to such stringent measures, and then we'll give the floor to the hospital authority. Thank you. See, in the past 24 hours, we have seen a major change in the local epidemic situation. I'd like to report to you our risk assessment. As at yesterday, we had 114 Omicron-related cases, as said by the chief executive. The number of imported cases, more and more of the important cases are Omicron cases, over 90% of them. In fact, globally, in the past 2 weeks, there were additional 11 million new COVID cases, leading to over 1 million deaths over the world. Omicron has spread to over 110 countries. So the pressure from imported cases will only continue to rise. We are recording over 30 cases per day. If this trend is to go on, it will be tremendous pressure on our healthcare system and our quarantine facilities. In the past 24 hours, things have deteriorated rapidly because we have seen a local cluster arising from imported cases. The index patient is 12676. Now, according to our epidemiological study, and it is spreading widely. In investigating the cluster, would like to report to you some of the characteristics to let you know the risks. Now, for many of the cases in this cluster, the CT value was low, many of them below 20. In other words, the viral load was high. So we believe the risk of further transmission from this cluster is going to be strong and high. They have been to different places in the community, taking part in a variety of activities, indoor gatherings and party gatherings and dancing, dining, etc. So the infections involved friends, family members, and even among strangers. And for the mode of transmission, some took part in outdoor public places. And the distance between two cases were quite far away. Usually, for people wearing masks, the risk of infection or transmission is usually low, but that is not the case for this cluster. So the risk of transmission associated with the Omicron strain is very high. And then in this cluster, many of the confirmed cases with high viral load has not been vaccinated. Now, for those who have been vaccinated, they may be asymptomatic, or the viral load may not be that high, and so they could evade testing and or they were not picked up by testing, and therefore the risk is even higher. We believe the pandemic has spread in the community, and we are at a very critical juncture. We must take decisive and stringent measures to stop the further transmission of the chains. The chief executive has just announced a number of measures. The Center for Health Protection will do our very best in contact tracing and quarantine arrangements. As for the community, I strongly appeal to the public into places where the confirmed cases have been to, we will issue mandatory testing notices. Please take note, we expect such locations to increase. So please be very vigilant. If you have been to these places, do be tested as soon as possible. And if you feel unwell, or if you're aware that you might have been in contact with a high-risk person, seek medical help as soon as possible. And as I said, it appears that in this cluster, those who have been vaccinated were not infected. So we would like to take this opportunity to appeal to you once again. About 30% of our population has yet to be vaccinated. When Omicron is in the community, for those who are unvaccinated, well, the risk and also the gravity of being infected will be much higher. According to our joint scientific committees, our recommendation is for those who have been vaccinated to receive a booster as soon as possible. And I must appeal to healthcare workers. You must be very, very vigilant. If you encounter patients with mild symptoms, you should encourage or ask them to be tested as soon as possible to get results. And may I remind you once again that you should be vaccinated as soon as possible, observe hand hygiene, wear face mask, and avoid unnecessary travel. Thank you. Dr. Ko from HA. Thank you. Good afternoon. The Chief Executive and also Dr. Lam have mentioned that we have obvious increase in the number of COVID cases in the past few weeks. And the number of admissions resulting from infection has also risen. In the past Sunday, we reactivated our 500 board beds in Asia World Expo on Lantau North to be prepared. As said by Dr. Lam, most of the cases were Omicron cases. As we all know, these cases are more infectious, so we expect these patients need longer hospitalization. Most of these cases will be treated at Asia World Expo and also the North Lantau Hospital. There are over 340 cases requiring quarantine, and we have about 800 beds at the Infection Control Center at Lantau North. If we are talking about 40 to 50 cases per day, then within 4 or 5 days, we will be hard-pressed for beds, because beds for infection cases are different. When the occupancy rate is about 70%, is close to saturation for infection control reasons, and also the time for turnover. So we have to prepare for the current situation. Overseas, as said by Dr. Lam, we might already have silent transmission chains in society. You may recall that during the third and fourth outbreaks, the number of confirmed cases per day could rose from several tens to a few hundreds per day. And from overseas experience, the number of Omicron cases could grow geometrically or explosively. So we have to be prepared. Apart from Asia World Expo and also the Northland Town Hospital, we are now reviewing our first-line beds in public hospitals. Now our burden is we are in winter and we have now reached our winter surge. Our surgical beds are already 100% full. If you have noticed our daily releases, so different clusters are now moving some of their patients, because when the pandemic is stable, we have to take care of patients admitted for other reasons. So we have to make available beds should there be a flood of cases from the community. We have beds available. We're also reviewing our ICU facilities. Among the few hundred COVID cases we now have, including Omicron cases, most of them are in stable condition. But then we are now admitting mainly patients who have been vaccinated. As said by Dr. Lam, according to literature and overseas experience, unvaccinated confirmed cases are likely to have more serious symptoms. So if we have a community outbreak, then there will be tremendous pressure on our hospital beds. As we all know, we have a few tens of percentage of the population not yet vaccinated. Most of them are elderly persons. So may I appeal to the public, if you haven't been vaccinated, do so as soon as possible. Our elderly citizens, in particular, should there be an outbreak, you can be in a very risky situation.
From the perspective of the hospital authority, we will strengthen our infection control measures. Like Dr. Lam said, we would enhance screening of patients. Some of the cases yesterday were identified as the A&ED upon screening by our colleagues. If you have to visit our general outpatient clinic or A&ED, if you have any contact history, or if you have any travel history, or if you are at risk of contacting with patients, please notify our colleagues to arrange a test. Like the Chief Executive mentioned, we will suspend regular visiting. For special cases, we will deal with these cases with discretion. We call for the public's understanding. Thank you. Now we open the floor for questions. We still have the briefing at 4:30 p.m., so please limit your questions to 2. And please use our mic to ask your questions and identify your media organization. The lady at the back. I'm from commercial radio. Now the air crew, the female air crew member, did she depart on a passenger flight and return on a cargo flight? Is there a loophole? And also, what about